Maybe we can wrap up by talking about some of the, the range of cases you've seen that that people have really benefited from, the ozone therapy, and probably some have really surprised you. Maybe you can share some of those examples.
I'm constantly surprised. I've only been doing this for 40 some odd years, but I'm still amazed. It's hard for me to believe that that somebody would have, say, in regenerative medicine, somebody would have a problem for so darn long, and I can come right along and fix it in a matter of weeks or months. It's astounding to me. So we talked a little bit about the regenerative aspects, but some of the other aspects that are amazing. Well, the first thing that comes to mind is viruses. It's a slam dunk. And yes, ladies and gentlemen, for the more recent virus that has shown up, that is, quote, kill lots of people, 100% treatable, 100%, never have a problem. Any virus, any viral infection that comes along, 100%. Why is that? It's because all viruses share the same issue, and that is they cannot tolerate the oxidizing stress of ozone, period, end of story. At the same time, it's killing virus. It also activates the immune system in a special way. And for anybody that's a listener that knows about this, I can just say that it activates Th1 immunity and deactivates Th2 immunity, which is exactly what you want to do to knock out viruses. So it not only kills the virus directly, it also kills the virus indirectly by modulating the immune system so that it works better. Because as everybody knows, if you get infected with the virus, it's not a problem unless you have a problem with your immune system. So you got to fix that immune system, and that's ultimately what's going to cure you, and ozone can do that. It's just great for cardiovascular disease, Joy. I can promise if somebody walks in my office and says, I've had 4 stents and the doctor says I need another stent, or I've got cardiovascular disease, I have this bad history, I've got angina, I can basically slam dunk for me. I love these cases. I just give them some intravenous ozone. We do other things, of course, but the ozone absolutely takes that out of the equation. We use it a lot for cancer. It won't clean up the arteries. So if your artery's gunked up, it won't degunk your artery. But what it will do is it will make the heart cells and the arterial cells, the cells that line the arteries, secrete more nitric oxide, which means they can utilize the oxygen they are getting better. Most of the time that the patients have cardiovascular disease, it's not just about the plaque blocking off the flow. It is about that to a degree, but it's also about the tissue itself not being able to utilize oxygen efficiently. And that combination of not being able to utilize oxygen efficiently, along with having less oxygen getting there, is what gives you the disease. We can't take the plaque out, but we can fix the cell so that the amount of oxygen that's getting to the cell can use 100% and basically take away the problem.
Beautiful.
So you can use it along with a stent. There's if you got somebody that's seriously ill and actually needs a stent or needs a bypass surgery, fine. Pre-treat them with ozone before they go have their surgery or their stent. Do that for about 3 or 4 weeks so that the cells are great. They'll heal great. And then the surgery will work a lot better.